Let's go back to that earlier story just a few moments ago. In fact, if you're watching, we're just saying that the Department of Health has welcomed an announcement by the World Health Organization that COVID-19 is no longer a global health emergency. The World Health Organization made the announcement yesterday after nearly 3 years since the declaration of the emergency level, basically. WHO Director General Dr. Tedros Ghebreyesus said the world is now better equipped to deal with the pandemic. More than 765 million people were infected by COVID during that period, and nearly 7 million died. But the WHO fears that the true figure could still be much higher. Let's talk further about this then. Bring in our guest, Dr. Tshwale, the Media Liaison Officer from the Department of Health. Doctor, a very good evening to you. I'm grateful for your time. So the welcome announcement from South Africa's part has been met with a caution, isn't it, that yes, the declaration is now removed, but COVID-19 remains?
Evening to your viewers. Yes, we welcome the announcement by the WHO Director General, and I think it's in cognizance of the fact that many countries, and including here at home, we have been able to put up measures to manage the effects of COVID-19. So there is a reflection from the reports from the WHO that there's a significant decline in terms of infections, and even in terms of how different governments or different institutions have put measures to manage the effect of COVID-19. It is no longer a pandemic that we could say that is out of hand and we are not able to manage it. And I think that is why there's a largely informed that decision.
And as things stand, vaccination is the only COVID-19 measure that remains. I wonder if it is enough.
Look, you wouldn't say it's enough because the nature of viruses keep on multiplying or taking diversions in different ways. But the system as it stands now, I think it's able to contain it. And then there has been, vaccination campaigns that have gone around that throughout the world, which effectively has made people to be safe.
Mm. And at the beginning of the vaccination rollout, I mean, before the vaccines actually arrived in South Africa, there was growing impatience about the pace at which we were getting to that direction, right? Then eventually we saw the first batch arrive, and many people began then to line up wanting to get vaccinated because they were simply fed up with being indoors and some of the other measures related to COVID-19 safety. But soon after that, we began to see numbers wane. And I wonder how much of a challenge that's going to be in coming months and coming years where COVID is concerned. How sustainable in the long term is the vaccination rollout as a means of protection?
Yes, it is true that that has been the challenge. I think in South Africa at the time when we got to receive the vaccines, there has been a growth of the anti-vax movement, which has been spreading the news that the vaccines are dangerous and all those kind of things. And I think it has been a struggle, a campaign between those who are pro-vaccination and those who are anti-vaccination. But the key thing that we have done, and I think even the WHO has recommended that needs to be done, is that the vaccination campaigns or measures that governments or any institutions have been taking up must be integrated into the daily healthcare systems that you'll find in the primary healthcare services, so that when people arrive in the primary healthcare facilities, they are able also to get the vaccination of COVID. Because ultimately, we almost expect that at some point the WHO will declare COVID-19 as an endemic kind of a disease that will permanently live with it, and we will have to put up measures that are able to contain it, as we have done with other diseases like like flu.
At the WHO yesterday, while it said that COVID is no longer a global health emergency, it did call for reflection on the part of countries. Many, in fact all countries, some would argue, erred in the initial response to COVID, mainly because little to nothing was known about what it was that we were dealing with. What we knew was that people were getting sick and people were dying. How is the South African government, the health department, reflecting on what has happened over the last 3 years and what now needs to happen to perhaps be able to better respond to other events in future?
Yes, COVID-19, the outbreak of COVID-19 has been a great lesson to many countries, even here at home. I think one of the key things that at that time, there were many of the governments that were not necessarily prepared to deal with the enormity of this pandemic. But I think the lessons that has been learned is that we need to prepare for pandemics as they would continuously break up. I know that there's going to be a World Health Assembly that is taking place in Geneva this month of May, towards the end of the month of May. The major key issue that is going to be debated in that assembly is the pandemic preparedness on the part of all countries in the member countries of the WHO, just to make sure that countries are impressed that they need to establish systems and even create some kind of institutions or units that on daily basis monitor the outbreak of pandemics and put up the systems that will make it possible for us to respond on time and make sure that the spread of those pandemics is highly controllable. And I think even here in the country, this is exactly what the Department of Health has begun to set up that kind of mechanism.
How it's one thing to prepare the department, to prepare the government for a response to a future pandemic. How do you prepare a country, a citizenry, for a similar event? Because it came, as we know, in 2020 as a massive shock to the system for many people, from the initial 21 days, which became 3 years, in essence.
The most critical thing is to understand that when you don't have a system in place, then it means that the whole citizenry will not be prepared. So you need to put up institutionalize a mechanism, which is the mechanism that will continuously inform the citizenry about the kinds of the health threats that might emanate or there seems to be lingering around that scientists are doing diagnosis about. So exactly that is the point that we are making, that we are institutionalizing that mechanism so that mechanism serves as an early warning. And when there's an early warning, then we are able to communicate to the citizens to say, no, there is this, there might be an eventuality of this kind of a pandemic. These are the measures that we need to take to put in place so that we are able to prepare ourselves for that eventuality. And that will also go dovetail with public awareness campaigns that the government will lead, and with different institutions and civil society movement.
Dr. Tshwale, Media Liaison Officer with the Department of Health. Good to speak to you, sir. Thank you very much.